speaking of our speakers, it's our pleasure and privilege to introduce them all to you. Tonight, we'll hear from Special Agent in Charge, Eduardo Chavez from the DEA. He'll talk to us about what fentanyl is, just how little a lethal dose is, and how fentanyl is getting into the hands of our youth. Officer Mark Blair is a school resource officer here in Tarrant County. He'll give this national and statewide overdose crisis local context by sharing with us the impact drug use, including fentanyl, has on the day-to-day operations and goings-on inside our schools.
After that, Medstar Operations Manager Heath Stone will round out our understanding of the local problem by sharing internal data about who is overdosing and where. It probably isn't what you're thinking. He'll also teach us how to recognize the signs of a possible overdose, what to do if we see those signs, and transition our conversation to a solutions-focused discussion, because we don't want this to just help you understand how scary this health threat is. We want you to be empowered to impact it. On that note, Dr. Tashara Jackson will close us out, close our presentations with some practical action steps each of you can take to help prevent any more accidental overdoses. Whew, that's a lot of important stuff. So without further ado, I'll pass it on to Special Agent in Charge, Eduardo Chavez.
Thank you, and good evening. And again, I just want to extend my appreciation on behalf of the DEA to Challenge of Tarrant County for allowing us this opportunity to talk about such a topic that is affecting our neighborhoods, our communities, our families. And so again, we appreciate this time this evening. Hopefully over the next 15 minutes or so, I can kind of give you all a crash course on fentanyl and how it's essentially infiltrating our homes and affecting our lives. So might as well just start out with basically what is fentanyl. Fentanyl is a legitimate medication. It's a Schedule II narcotic drug. Within the medical community, it's used primarily as an analgesic and as an anesthetic. If you or anybody you know may have had a surgery or some sort of medical procedure, you actually may have been given fentanyl during your anesthesia process. If there is some chronic pain or some long-term pain, medical professionals may actually prescribe fentanyls. They usually come in patches or other sort of very topical types in very small dosages. It's usually actually dosed by the microgram. And so it requires only a very little amount to go a long ways. It's 100 more times potent than morphine. It's also 50 times more potent than heroin. In its original form, it comes in a white powder. You kind of see there at the top right-hand corner of your screen. However, what we have seen over the last several years, and in particular over the last several months, in particular in North Texas, is the prevalence of fentanyl in counterfeit medications. So those particular cases, it is not the legitimate pharmaceutical. It is not coming from a pharmaceutical manufacturer, but rather from a drug trafficking organization that is making a pill look like hydrocodone, Vicodin, Percocet, even oxycodone, and then it has none of those substances in it. It actually has fentanyl. 90% of the fentanyl that comes in the United States is coming up through Mexico. There is a substantial portion that is also coming in from China. However, that tends to be more of the online purchases in smaller amounts. Both Chinese criminal organizations and Mexican criminal organizations have essentially allied together, where the Chinese are providing them with the raw fentanyl powder, and Mexican drug trafficking organizations are then making them into tablets and pushing them over into the United States for distribution throughout. There is a part that is pharmaceutical diversion, meaning individuals who perhaps get it legitimately prescribed or sort of skimming off the top and selling it or diverting it for non-medical use. And also, of course, there's the straight out theft or robbery of pharmacies or in the transportation of that. as well as sort of, inside jobs where, somebody in the chain of the medical profession is taking some and embezzling some for the black market. The profit is very lucrative, and that's actually what makes a lot of the Mexican drug trafficking organizations so interested in it and attractive. If they're purchasing a kilogram of fentanyl from China, it's only really costing them about $3,000 to $5,000 per kilo. But because you only need such a small amount, you can actually turn that into profits up into upwards of the million to $1.5 million. So for a drug trafficker, little investment goes a long way. Unfortunately, at the cost of those who are struggling with addiction. When you are mixing fentanyl, what does that look like? The unfortunate part, again, going back to these Mexican criminal organizations, there is absolutely no quality control. There is not the intent that legitimate pharmaceutical manufacturers have by making sure that first pill is identical to the millionth pill along the assembly line. In this particular case, these laboratories are in clandestine warehouses deep in south central Mexico. And when they're mixing these tablets are primarily made up of caffeine with only a few instances of this fentanyl. And as I'm sure all of us have seen the news over the last several years, we saw the mid-Atlantic and the northeast area of the United States succumb to a staggering amount of overdoses, accidental overdoses, and overdoses leading to death because of this, because actually these Mexican trafficking organizations were using the consumers, unfortunately, as guinea pigs, realizing that they were putting too much fentanyl into these tablets, and it was actually killing the drug user. For a Mexican criminal organization, killing your customer is not good for business. So unfortunately, over these past several months, they have actually become experts at ensuring that there is enough of an amount of fentanyl to make sure you have those effects, those opioid effects, but ideally maybe not enough to actually have you overdose. Then again, there is no quality control. So that first pill will not be identical to that millionth pill. And as this graphic sort of shows, even in the mixture of 5 pills down the assembly line, you can kind of see how that active substance can vary from pill to pill. 2 milligrams, only 2 milligrams is considered a lethal dose for most non-opioid dependent individuals. On average, we had a big seizure in 2016 that was right underneath that 2 milligram mark, but even more so now coming into 2019, 20, and now 21, we are seeing actually more pills really hitting that ceiling, averaging about 1.5 to essentially 1.9, 2.0, and even higher milligram amounts of fentanyl. So that is essentially Russian roulette with your own life without realizing it, because these pills do not say fentanyl on them. These drug traffickers are not selling it to consumers saying, hey, it's fentanyl, make sure you don't take too much. They're marketing it as oxycodone, as hydrocodone. We've even also seen it in counterfeit Xanax bars to where the consumer is perhaps thinking that is what they are taking. So therefore, if a user who is already teetering on that addictive stage of opioid use, and they're used to taking maybe 2 or 3 hydrocodone to get that high that they're looking for, if they bought this off the black market, unknowingly, they have already maybe taken a lethal dose of fentanyl. And that is where we've seen this uptick within Tarrant County, within North Texas, even upwards into Oklahoma, where individuals are overdosing, not because in their minds they're thinking they're taking too much hydrocodone or Xanax or oxycodone, but rather because they unintentionally took a lethal dose of fentanyl. Some of the pictures I just wanted to show you here is unfortunately near and dear to all of us because they are happening here in our backyards. The drug trafficking users have now been able to find avenues to potentially even make this in their bedrooms. And so being able to tablet them and count them and to make sure they're looking identical to the oxycodone or the hydrocodone, and and they're just being able to market it and have it in their own home. An average pill costs as little as $5 per pill. In this particular case, in the picture to the left, where we have some of our agents processing counterfeit, in that particular case, it was counterfeit hydrocodone. The individual responsible told us that he was able to purchase them in bulk for only $3 a pill, and then would turn around and sell them for $5. Unfortunately, this makes it a very, very affordable drug to essentially risk your life. As you see there in some of the pictures in the upper right-hand corner, you see sort of this Tupperware with a pill counting machine. In the lower right-hand corner, the complimentary photo of these pills that they were actually pill bottles, rather, that they were actually making labels for to make sure it looked like it was actually hydrocodone that came from a legitimate pharmaceutical manufacturer. So again, these drug traffickers are going to great lengths to reassure perhaps the user is not counterfeit, that it is not fentanyl. There's been enough of a public awareness to the word fentanyl and what it might do and the risks associated with it. And so a lot of drug traffickers are denying pills, denying that they contain fentanyl. And therefore, if they can have this bottle and it says, hey, this came from a legitimate pharmaceutical manufacturer, and it looks like a bottle, it has a child-proof cap on it, the label looks legitimate, somebody might be more prone to believe them, number one, and then two, to take the amounts they're used to taking with this counterfeit drug. The lower right-hand photo is baggies and baggies full of counterfeit Xanax that contain fentanyl. You see there in the the upper left-hand corner picture, it's mimicking these Oxycontin 80 milligrams. That was from several years ago, where we first started seeing Mexican drug trafficking organizations really perfect the coloring, the stamps, make sure that the binder of the pill stood up to pressure. Years ago, we would see some of these things in a previous office to where the colors were very Crayola-like and it would crumble very easily. And even the stamps where it would say OC or 80 or whatnot, crooked, and just didn't look very good. Once again, nothing but time and creativity in these criminal organizations. And so they've been able to perfect this to make it look as much as like the real thing as possible. Mentioned earlier, the average pill can go for as little as $5 per pill. If you are, a new customer perhaps, or new to this market, you might actually get taken for up to $40 a pill. But on average, we are seeing a good $20 on the black market. As you see just by some of these news clips, unfortunately, North Texas and the rest of the United States is not immune to any of this. We've seen several high-profile overdose deaths. But again, to me, it's as important as if it affects you or your family, it's high profile for us and for the DEA. And so it's not just reserved, unfortunately, for celebrities and professional athletes, but it's affecting our own homes in our own suburbs. We are constantly working with some of our private sector partners and some of our social media companies to help them also understand where they may be inadvertently complicit in allowing this trafficking to happen, and making sure that they try and work to suspend some of these usernames where we see individuals perhaps trafficking in these drugs. We do a lot of conversations with organizations and with even parents and school districts where they want to know how social media is intertwining into this world, and how they can essentially help mitigate that risk, not only for their students, but they're asking about their sons and their daughters and their younger brothers and their younger sisters. We've seen in a lot of occasions all mediums of social media being used to traffic drugs. At the time it generally gets to this level in social media where you are arranging to purchase drugs, it's not with the Mexican drug trafficking organizations directly. Chances are it's already with a retail dealer looking to sell just the user amounts to the consumer. Snapchat is very possible simply because the message will disappear. If an individual screenshots the conversation, it notifies the other user. So perhaps, if I'm the one trying to sell it, I won't see that guy anymore because I got a notification that he took a screenshot of our conversation. But that's where you see a lot of that interaction, and a lot of it is not that difficult to crack. It's, hey, do you have any more of those? Hey, can you meet me here? Hey, I'm out and I need some. Just some of the language that is not makes you leave questions as to what exactly they're talking about. And so, in a lot of conversations we will have with parents, educators, and counseling organizations alike, is just simply to actually have those conversations and be able to talk about that elephant in the room. In particular, if you feel that it is a little fishy. In many occasions, what we have seen over the last several months is marijuana users getting free samples of these counterfeit pills from the person that they purchase their weed from. And again, if you look at these criminal organizations, much like a business, they're going to give out free samples of their product, just like you might take free samples from a business at a local craft fair. It's not that far removed, with the exception of an illicit product. And in that particular case, if your son, daughter, brother, sister, your neighbor is a regular user of marijuana that is purchasing marijuana from the person down the street, it would not be surprising at all to all of a sudden have that dealer offer up a few pills as a free sample on the off chance that they become repeat customers. And again, going back to that profit margin, it is a very steep profit margin for these individuals. And unfortunately, again, it's definitely a Russian roulette from our perspective, simply because the first pill may have only trace amounts of fentanyl, maybe not even a milligram, but yet the other pill will have more than a lethal dose. The DEA, we've got several resources online for parents, educators, caregivers, teenagers, a little bit more tailored to them as well. All of these websites, in this particular case, I urge you to screenshot this particular slide and to take a look at it. Both of our platforms are available on the .gov and the .com, so you'll be able to find it. But there is a lot of great information, very just fact-based information about what it is, a lot of photos for people to get educated on, and hopefully, maybe kickstart that conversation with their child or their student or their neighbor. We here in the DEA, we're always happy to be able to provide a lot of resources, conversations like this, in-depth conversations, depending on an audience. Cynthia Velasquez is our Virgin Outreach Coordinator. Her contact number is above. We urge you to reach out to her if you or anybody associated with your organization or your school are interested in learning more or hearing more about any particular thing. And we ask you to follow us on our Twitter handle to be able to get some of the latest things that are going on and to kind of stay updated with what the DEA here in North Texas is doing. There may be questions. I know we can throw them in the chat and then circle back around at the very end. Very appreciative to Challenger Tarrant County for allowing us just a few minutes to share our experiences. As far as the DEA is concerned, we fully understand and appreciate the fact that this entire fight against illicit drugs is multifaceted. It is treatment, it is substance abuse counseling, it is education, and a piece of this is enforcement. And that is where the DEA comes in. We are not looking to arrest drug users. Our primary mission is to go after these criminal organizations that are feeding these unfortunate individuals who have succumbed to addiction. And for that piece, that in our minds, what rounds out a good drug enforcement strategy is all of those factors. So again, I appreciate your time. I'll go ahead and stop sharing my screen right now. And I think at this point, I'm going to go ahead and turn this over to Mark Blair, Mark Blair is with the Fort Worth Police Department and is a school resource officer. So Mark, take it away.
Thank you, Special Agent Chavez. A lot of what Special Agent Chavez was talking about is some of what I'm going to touch base on, but I'm on a campus in a high school in Fort Worth, Texas. And so my perspective is what I'm seeing and hearing from the students. One of the things that our high school is doing is, the more that this has become prevalent, we've started to go around classroom to classroom, have these discussions with smaller groups of kids, just kind of informing them of what's out there. Some of the things we hear from the students themselves is they have never heard of the word fentanyl. Some of them have heard of fentanyl. Some of them have known people who are directly affected by it. And some of them, some kids can't even tell you what it is. One of the things we're doing is when we are catching kids at the school, either with either have used or are under the influence or in possession of something, we're trying to use restorative practices and not just discipline them, but also give the parents and the youth other measures of whether that be counseling or treatment facilities. Kind of like Special Agent Chavez said, my goal and our goal as a department is not just to arrest these people that are suffering or using. At the high school, Matt, we've had a couple of overdoses this year alone. Some of them had included fentanyl, and so it kind of piqued my interest and made me want to understand a little bit more on how we could save lives, not just at my school, but in the community as a whole. So some of the things I've been doing was learning from Special Agent Chavez, multiple things that I've been passing along to the students, to parents. I've helped parents get kids into treatment facilities if they feel or they know that their kids have been using drugs. Another thing we're doing is we've made flyers, pamphlets, we posted them around the school that talk about fentanyl, PSAs. We have security guards at our school. We're checking bathrooms frequently. We're locking up a lot of the higher visited bathrooms to where they're kind of more tucked away in the school to where we can kind of monitor those. The security, myself, we're doing checks on them often. And one of the biggest things that I see to work with me and at the school that I've been at for a few years is building the relationships. And that doesn't just go for the SRO, but that's the teachers, the administrators, the counselors, and parents. It's very important. What helps me the most is when I build a relationship and earn trust with these kids, I find a lot of them will come and talk to me and tell me, hey, I was at this party this week, and kind of like Special Agent Chavez said, there's these people and they were passing out free pills for sample. I didn't take them. I didn't know what they were, but I had a friend that took them and they started acting messed up. And so kids will talk to you once they trust you. And I feel like that's been the biggest thing. And we've been able to help out some kids and find them resources and help for parents. Another thing is students are telling us kind of what Special Agent Chavez said is it's as simple as being on Snapchat and a dealer saying, hey, I'm open for business starting at 6 p.m. tonight. Come through. I got, all these pills, and they don't usually say fentanyl. They'll tell them the Percocets, the oxys, those kind of things. And a lot of kids say that who they're getting these messages from, they're not even looking for them. They can just be sent to them through friends of friends. And so they're like, oh yeah, it's out there. And a lot of them are their local weed dealers. It's kids who sell weed will start to dabble in selling pills, make a little bit more money, make it a little bit easier. And so my advice to parents is just having those conversations. Like Special Agent Chavez said, is they're not always comfortable, but having those conversations, checking your kids' phones, checking their social medias, and kind of getting in touch with the lingo and the terms and what's going on. One of the things kids talk to me about when I'm in the classrooms with them is, my parents don't talk to me about drugs. And I've had to, unfortunately, have conversations with parents who have lost their kids due to overdoses. And they said, I didn't have that conversation with my son or daughter because I just didn't think that was them. And maybe back in the day, there was more of a stigma or a type of what you would look and be like, oh, that kid looks like a potential drug user. But these are kids who are athletes and straight A students and a part of groups, and they're popular. And it's not just the depressed looking kid who just looks like, man, they're struggling. We're having kids get offered pills at school, in the bathrooms, not even necessarily at parties, just in other settings with other kids. So it's just really important to make sure that you're having those conversations. Your kids can avoid parties, and it doesn't mean that they're going to be able to avoid being offered something. It's not that the school that I'm at is super unsafe. It's just very, very hard to monitor everything that's going on. And so we're trying to be proactive instead of reactive. Some of the other things that I was going to talk about is kids are straight up telling me, like, if my parents asked me, I would tell them what I've tried or what I've maybe experiment with, but they don't have those conversations. The relationship is the biggest thing that I would say, and don't assume your child's making the right choice at all times. I know that's difficult. I'm a parent as well. This is very eye-opening to me as a parent, as a police officer, that it could be one time for a student to make a poor decision, and it could be the last decision they made. And unfortunately, like I said, we've seen that in our campus this year alone. And so just have those conversations and make sure that you're doing your research and staying in touch with your kids. I think that it might come off as an annoyance to them at first, but they'll ultimately appreciate it in the end, that their parents are very concerned about what they're doing and having these conversations. And when I have these conversations with kids in the classroom, sometimes it's uncomfortable and they're not really paying attention at first, but by the end they're like engaged and they're like, okay, I'm going to talk to my little brother or sister at the middle school or the elementary school so that they're aware of what's going on as well. So that's really it. We're doing our best, and we're going to continue to find ways to help these kids. So like Special Agent Chavez said, I'm sure there will be some questions at the end, but I'm going to go ahead and pass it on to Heath Stone, who is with MedStar now.
All right. I appreciate it, Officer Blair. First off, thanks for having me this evening. Touchy subject, but something that we're all very passionate about. My name is Heath Stone. I work for MedStar. I'm the operations manager / paramedic for MedStar here in Fort Worth. We cover Fort Worth along with 14 other cities. So a big chunk of Tarrant County. And what we've seen is it's kind of been a slap in the face for us and a little bit devastating. Over the course of this last year, the increase of opiate-induced overdoses and Narcan reversal we've seen is just something quite flabbergasting, if you will. So I'll share this real quick. There we go. Get this thing going. Oops. All right. So right here, if you can see this comparison from 19 to 20, nice little gray line. Can y'all see that okay? To make sure, cool. Okay, so 19 to 20, nice little gray down there at the bottom. It's not too high, but it's high enough, and it shouldn't be there to begin with. But if you notice, right when COVID started, and I guess the slide's a little off there, but let me get it kicked over. There we go. Right when COVID started around March, officially a pandemic, nobody knew that we were actually launching two pandemics, right? So we were launching the COVID pandemic, and we're going to launch an opioid overdose pandemic, right? Specifically to the fentanyl of nature. What the crews are starting to see, what we're starting to see is not so much on the heroin side of things. It's just like the agent was talking about, and Officer Blair's, the pills, the M30s, the bars or Xanax perks, all the way down to boiling down stickies, the patches, and taking the juices out of that and putting them in jewels and smoking this stuff. The moment you think you're educated enough on drugs is the moment you're wrong. And so you have to stay up on this stuff. You have to talk, you have to learn the lingo, the way that they're using and coming across these things, just like the officer was talking about, along with the agent, is astounding. And just a click of a button and the chat's gone as well. So on Snapchat, like, hey, where can I get some M30s? It's deleted, it's gone, right? So if you don't have a tracking app or a monitoring app on your child's phone, you're never going to see it. So we noticed a dip in August, and everybody remember what happened in August? Kind of lifted some things up. People got out and about, no longer at home, moving around, and then it started climbing back up. They got comfortable around their friends. They're back in school, no more virtual learning. They're starting to see the pills. They're starting to get the stuff a little more conveniently, unfortunately, in school. So we were seeing overdoses in bathrooms, high school parking lots. When the sporting events kicked back up, we were finding it in the stands. And these guys all contribute the same symptoms, right? Barely breathing. This stuff's a lot stronger than your typical opioid. It's 100 times stronger, 100 times harder to reverse. So we're giving a little bit more Narcan than normal. We're not getting the response we need. And sometimes it's a little too late. And it's sporadic, kind of like Officer Blair was talking about. It's not just to one location or one area. And I'll show you that. But if you just want to look right here in the change percentages from 19, 20 to 20 and 21, June, July, September, then Christmas, it kicked back up. But look at January. Wow. First of the year, we start off with a bang, the wrong kind, right? Here's kind of the heat map we're going to dive into. And so down in the central areas, central is kind of a big area, even though people don't realize that. It's tight, but it's a bigger area. A lot of population is very dense. Out to the west side of Fort Worth, headed way up into the northern areas. So your Saginaw, Eagle Mountain, Keller ISD, way up to the Northeastern, all the way up to Northwest ISD. Your Roanoke's headed out to the north part of Newark. And then we get down to Johnson County, you're seeing it down there as well. So it's everywhere. Here's kind of the heat map. So you're seeing this heavy stuff here. And this is just what I was showing you. This is the heat map for that calendar year. Mind blowing. Right in the central division. So it spreads across to the east, but it's in the west, head up in the north, down in the south. I'm not a weatherman. I'm telling you, this stuff is all over the place, and you're not going to be able to avoid it unless you start talking to these kids and realize what's going on. And here's a little zoomed in to kind of show you. It's not just dead center Fort Worth. It spreads everywhere. We run a lot down in the central area, and it's not all teens, it's not all kids, but that's a lot of where your dealers are, a lot of where you're seeing a lot of this stuff spread about, and it's easy to get. You don't even have to go down in a dark alley anymore. You can kind of just walk right up to the train station and ask the first person. They kind of know where to tell you where to get it. So I'll stop sharing right now. I don't know if it'll let me. I guess not. Anyway, we'll leave that up. Kind of the things I want to talk about is the things you need to look for, the signs and the symptoms that we start to notice is, and it was probably covered, but the irritability, the things along those lines. There we go. Perfect. The stealing, we hear a lot of parents say that we noticed like the coins were going out of our collective coin jar, or, his Xbox went missing, but he let a friend borrow it, but the grades are still good. Okay. Right. Grades are still good. They're still focused fine. Or they're getting in fights and stuff like that. But when we get there, they're tired a lot. Okay, cool. Well, they don't eat as much anymore, or they're staying in their room a lot. Okay. When we usually get to the scene, it's kind of the last chance. They found them. They're blue lips, their blue fingernails, their fingernails are blue. They're gurgling, they're snoring. You can't wake them up. Their pupils, they're very tiny, pinpoint. As small as your pupil can get, you'll see that. And it's that moment that the Narcan may or may not work, but that Narcan's amazing. And we're having to get a little higher doses as we come across this stuff. It still is, I guess, mind-boggling me to the amount of the crews that are coming in and talking about the stuff they're seeing and the new ways they're seeing it, and then the age that they're seeing it in. It wasn't but a couple of weeks ago that they had a 9-year-old, right? 9 years old. Where did they get it? 2 houses down. It was that easy. 2 houses down. The older brother was honest about where they found it because they had trust, right, with their parents, just like Officer Blair was talking about. And I think that is humongous in your family, that you build that trust, right? There is some punitive to it, but if you build that trust that it's okay to come talk to you, then it helps as well. And that's the same thing with on our end as first responders. We're not there to get anybody in trouble. I've made countless scenes on these overdoses, and it's the last thing on their mind is for anybody to get in trouble. They just want to know what it was so we can help them, and we'll get them to the hospital, and they want to know where you might have gotten it so they can put a stop to it. Just like Agent Chavez was talking about, they are out there, they are trying to do this stuff. And if we can get the word out and we can start finding these things, these gentlemen can do their jobs. And it starts in the school. Officer Blair, like he's talking about with his parents, Officer or Agent Chavez, finding those resources, those links, spreading the word. There's no shame in talking about drugs, right? And so what is funny is you come in there and you start, hey, did you use any weed today? They're going to giggle at you, right? But you're going to break that ice. You're going to start that conversation. And I think that helps a lot. The other thing to look for is you're not going to start seeing a lot of needle tracks on these guys. We're not seeing them shoot it up as much. They're finding the easiest way possible to get that high. And it may just even be a little piece of the pill. And Agent Chavez had some great pictures of that stuff, because that is identical to what you find. And it's just amazing. The lozenges, and those are newer. We just started seeing that, but like the cough drops, it looks just like a cough drop, but it's got fentanyl in it. I don't know how they do it, where they get it, but it's amazing that they are that creative to try to get that stuff around. But I'll end with, before I pass this off, that no drug dealer cares how good their quality is when they're selling to kids. All they care is that the money spends the same, and the potency of that stuff is immeasurable at times. And you can't just dip it in a tube and say, well, only 2 grams in that one, but I'll tell you 2 grams and think of 3 grains of salt is enough to be lethal. Right. And sometimes not enough Narcan can reverse that. So that's all I have. And I'm going to hang tight for the Q&A, because I'm sure there's going to be plenty of that. But I want to pass this off to Dr. Jackson. And I appreciate Challenge of Tarrant County for having me on, and everybody. So thank you.
Thank you, everyone, for hanging on to this portion. I am a licensed chemical dependency counselor and I'm a professional school counselor. So I see things within the school system and outside the school system. And I just want to give you guys some action steps. I want to give action steps for parents and guardians and caregivers. And I also want to give action steps for students. For parents, and this is kind of a reiteration of what people have already said, but it begins with just having the conversations with your kids, being open, knowing that it's a difficult conversation, knowing that you're not going to hear what you want to hear, but you're going to hear what you need to hear. Um, but it doesn't have to be like the talk, you know. Uh, Talk to your kids while in the car. Listen to the music that they listen to, and just talk about the music. Um, Ask your kid, like I don't believe in giving kids an out. So I don't ask, are you doing drugs? I ask, so what drugs are you doing? And they will feel very shocked, like, what? I'm not doing anything. Okay, well, what drugs are your friends doing? What drugs are the people that you know are doing? And get that conversation going. And then it's, what drugs are you doing, or what drugs are your friends doing? And then it's, what drugs have you been offered? Because they may not admit to what they're doing, but they will admit to what's been offered to them. And then it's, um, what drugs have you heard about? You know, and so just, and again, it's having that open conversation, and letting them know that it's safe to come and talk to me. Yes, I might get upset. Yes, there might be some consequences, but it's still okay to come and talk to me. Because if they're not talking to you or some other responsible adult, they're talking to the wrong individual, or they're not talking to anybody at all. And also Google. Our kids are Googling things to find out information. Google with them. You know, don't be afraid to search things up for yourself. If teach them teach them how to find reputable resources, and that just because it's on whatever website they're going to does not mean it's a legit website and is giving legit information. Um, Also, don't ignore pills. One of the things is, pills they're seen as being, the threat of harm of a pill is seen as very low, because from the time they're little, kids are taught to take pills. You take, you know, we take an aspirin, you take your vitamin. You mentioned lozenges, Mr. Stone. You know, take your cough medicine, whatever. So it's something that's edible. It's seen as, well, it's not the hard stuff. I'm not injecting it. I'm not snorting it. It's those different things. So take pills, investigate every pill you find. If you find a crushed pill, if you find a piece of a pill, if you find a whole pill, look it up. You can Google the color and the writing on a pill to find out what it's supposed to be. And I'll say supposed to be because we know it's not always what it's supposed to be. But you have to educate yourself and educate your kids while you're doing it. Um, Seek support. I spoke with a parent one time, and she said she felt embarrassed that her kid was that kid in the neighborhood. And I said, no, ma'am, don't feel embarrassed. I said, take pride in the fact that you're not ashamed to say that your kid needs help. And you're not ashamed to say that my kid needs support. I said, where other families in the neighborhood are pointing to your kid while telling their kid to be quiet, knowing that their kid is doing something as well, but it's staying in-house. So don't be ashamed. It's Mental Health Awareness Month. Substance use is just a sign of something else. It's a sign of there's something else going on, and the substance is being used to cover up or address that, whatever it is that's going on. For the kids, for students, when you're little, you learn about stranger danger, and you learn not to take things from strangers. And the biggest thing I hear is, but I trust him. Oh, but that's my connect. I've been getting stuff from him or her. Don't take things. Just don't. And I know it's easier said than done. And I know the whole social thing and the peer influence and all that, but just don't. And it's literally, I know adults can exaggerate things, but on this one, it literally is, one pill can kill you. We've seen it time and time and time again. And one pill can actually kill you. And it may not be this pill. It may not be that pill. You're literally playing Russian roulette. And then don't be afraid to ask for help. I have Kids and young adults who come and talk to me about things all the time. Sometimes it's drug related, sometimes it's not. Sometimes it's, hey, I need to get help from my friend. Sometimes it's telling me things that have gone on that maybe the parents are not willing to tell me about, but that kid knows that their friend needs help. And that's okay. Um, just recently, I had someone come and tell me, hey, this group of kids are going to go do this thing after school. Okay, cool. And I went and had a conversation with some of those kids. And I just said, hey, I don't know what you're doing after school. It's been brought to my attention. I'm not in control of what you're doing after school. But what I need from you to do is to realize you have goals and you're really close to meeting some of those goals. So think about if this thing that you're about to go do, is it worth missing that goal? Is it worth pushing back or possibly just totally deleting the things that you want for your future? And so it's not necessarily drug talk. It's the, what do you want for yourself talk? Will this thing get me to where I want to be in life? And am I willing to pay the consequence if not? Because everything has a consequence. That consequence could be good or that consequence could be bad, but everything has a consequence. It's a matter of, are you willing to pay that? But find a supportive person. I always say have one adult that you trust that's supportive in every area of your life. So one at school, one at home. If you have a place of worship, one there. If you're playing a sports, one there. But in every avenue of your life, have one adult that you can go to. Because you might can go to this adult for one thing, but you can go to this adult for another thing. And just have that and build your support system and look out for each other. And that's what I have, and I'm ready for Q&A.
All right. Well, thank you, Tashara, and all of our speakers. That was a lot of really practical and probably really eye-opening information. We have had quite a few questions come in, so I'm going to dive into these here. Let me scroll back up here. First, this question actually has come in a couple of times, so I think it's one we definitely want to answer. Can fentanyl be found in weed? And Agent Chavez, will let you take that one.
Sure. Absolutely. So anecdotally, we have had instances across the country where there have been fentanyl combined in with marijuana. Whether that has been inadvertent, meaning the fentanyl was being transported also in marijuana, or that was actually an intentional usage to combine. One of the other things that we have seen, as I think Mr. Stone actually alluded to, was you have to get away from what you think is a stereotypical drug. And it is not going to be as much the skinny homeless person with a needle on their arm in the park bench. It is the person in front of you in the grocery store. It is the person in line next to you at the gas pumps. It is your neighbors that wave to you from across the street as you roll up into your driveway. There is not one in particular stereotype that unfortunately fits a drug addict. And in this particular case, with the advent of e-cigarettes and vapes, we have seen a higher propensity for individuals to be able to smoke heroin, smoke opioid related drugs, in particular, something like this with fentanyl, where you can actually then, sprinkle a crushed up pill into a vape pen and smoke it that way. We've seen that included with the THC and the vape pens. So it's not like you most likely are going to sanitize and clean it out in between uses to where you had THC the first time and now you're on to crush a pill and maybe vape this heroin. So that is where we're seeing a lot of it come up. I'm going to front load one of the other questions since it's a little bit related that I saw in the chat with how can you tell if a pill has fentanyl? That's the whole point. We cannot. Right now, the only way we have been able to determine whether a pill that looks like oxycodone, hydrocodone, Percocet, Xanax, anything like that is through a laboratory analysis. So if patients are out on the streets and they seize pills, we are automatically treating them as if they contain fentanyl. So we are taking our proper precautions with our hands, gloves, masks, things like that to handle these things, simply because you don't know what they contain. And it is just paramount for everybody listening to understand that you cannot tell the difference. And that is exactly why we have kind of tagged on to this hashtag one pill can kill. And that's very true, simply because you do not you cannot distinguish it from a test kit over the counter at Walgreens. It is literally our DEA forensic chemists and state chemists that are able to distinguish it at that juncture.
So I think that probably does answer another question I was eyeing on the list. This person very thoughtfully asked about harm reduction options for counterfeit opioid use. Obviously, the least risk scenario is no use at all. But if someone buys a pill from a dealer, are there any signs to look for, which you just answered? There is not, or any testing kits available?
Because synthetic opioid, test kits are not readily available to the public for testing in that manner. And frankly, even for us, we consider it a very delicate procedure to even conduct field tests of what we might suspect, only because of the dangers of inadvertent ingestion. And so for us, we actually take all these, treated as if they were almost like a hazardous waste type of material. We double bag it into our evidence bags and we transport it to the laboratory so they can actually test pills under very strict and a controlled environment. So it is that concerning for us when we encounter these pills. And unfortunately, you have teens, young adults, and adults alike who will have them in their pocket. They'll have them just in a paper baggie and hand them from one person to another. And so once again, a very risky proposition. I agree with the individual that obviously no use is ideal, because if they're already purchasing these pills outside of a licensed pharmacy, outside the direction of a medical professional, there is already an underlying concern and an underlying issue that should be addressed. And so unfortunately with this now, you're just actually taking your life into your own hands with this sort of substance abuse.
All right, thank you for that. Tashara, this next one is going to be for you. This question asks, is there a place for kids to go for help besides treatment facility? And if treatment is our only option, how do we make that connection?
Most hospitals and mental health facilities will provide free mental health assessments and provide options based upon the results of those mental health assessments so there could be what's called, I'm losing my words, IOP, which is an intensive outpatient, which is basically instead of going to school, they will go to treatment for the day and then come home. And then the next step up from that is PHP. And it's more intense. It might be more days or hours involved, but they still come home. And then you have residential, where they go and they stay at a facility. You also have counseling. There are support groups. It's a myriad of options out there. If your kid is in school, I highly recommend contacting their school counselor or their intervention counselor or their school social worker or whatever mental health professional is connected to your child's school, and they can provide information for you specific to your child and your area and all of that. What was the other part of the question? I forgot.
I think that was it.
Okay.
And that's exactly it. We're big fans over here of school counselors and school interventionists and all that you do. And I think that's a great first step, to get connected to different treatment options. Because like you said, there's so many different levels of support and treatment out there. And y'all are such great resources for helping explore that.
What I will also say is, if for whatever reason your child is receiving any kind of mental health support outside of the school system, please do not be ashamed or embarrassed to let the school counselor, intervention counselor, mental health person on your campus know, because we need to know how to support them, because it's not an individual thing, it's a systems thing. And so we want to make sure that these kids are getting the support that they need, again, in every area that they go in. So how can we best support them at school? This is the behaviors that we're seeing at school, or this is, within the limits of confidentiality, this is what we know about what's going on with them in school. Let's communicate, let's work together, let's do this team approach so that we can create some healthy adults.
All right, thank you for that. Officer Blair, I think this next one's probably for you. This question asks, what are the penalties for a student caught dealing these pills, both in and outside the school?
Well, it's kind of twofold. So if you're caught with pills and you're in possession of pills, it can be a felony, but then also it can be a federal penalty, where Special Agent DEA Chavez could talk on that. It depends on, how many you're in possession of and all those sorts of things. If you sell a pill that they can link back to killing you, I mean, you can step in DEA Chavez and inform them, but I'm pretty sure you can be charged with the overdose of those, that person. So I don't want to speak out of turn, but if it's in school, what happens is they automatically are going to be suspended, more than likely, for the typical 3 days upon a hearing to go to an alternative school. And that's all school side of things, school-based things. If it ends up being a pill, a narcotic, then they can also go to juvenile or jail, depending on their age. If they're over the age 17 or older, then they'll go to adult jail. If they're 7 or 16 or younger, they'll go to juvenile jail. The pill will be tagged into a property room, the Fort Worth Police Department property room, under investigation. So a lot of times kids will be like, oh, no, it's really not that. It's fake. It's this, it's that. And we don't know, we don't have field testing kits, kind of like Special Agent Chavez touched on. So we go based off of, were you acting like you were selling it as a drug? What was the premise behind how you were going about that? Because we have kids that'll do that with, marijuana or whatever. They'll talk like, oh no, it's just oregano. It's what are you acting like you have possession of? And down the road, if it ends up testing negative for a narcotic, then maybe that will happen. But there's a chance you're going to spend the night in jail, a couple nights in jail, and have to go through quite a bit of issues. So they get in trouble with criminally, and they get in trouble school wise. But on top of that, I was letting them know too, and that's what I think somebody had mentioned earlier, is I'm also telling kids, I'm not just out there to arrest people. I gather information, and I'm in communication with our narcotics division often, whether it's kids who come up to me and they're like, hey, I'm really concerned about my friend. I think they're starting to hang out with drug dealers. This is kind of a vehicle that they were in, or this. I'll pass that information along, but I don't want kids to think, oh, they're going to come tell me now they're snitches and I'm going to, search the kid immediately. I want them to feel comfortable. And then they were just saying is I'll help them get to the intervention counselor, help them find resources or whatever. So.
Wonderful. Agent Chavez, did you want to add anything onto that?
Yeah, no, absolutely. And I'm going to still circle back just with one extra comment on testing, because I want to make sure our audience, parents, everybody do not feel some degree of misguided comfort in, oh, well, they're using some test strip to make sure it's okay. And they think they're being smarter than the drug user who's just trying to get a profit off of them. The best way to give you an example of why test strips are ineffective when it's something like this, assuming the test strip is even able to pick up a synthetic opioid, that'd be like putting a habanero pepper in the middle of a big burrito. And you have a burrito that doesn't have the habanero in it, and it's going to come up negative. But yet, if you happen to test right in the middle, right where it's at, it's going to come up positive. The quality control that is in these pills is non-existent. So just because you tested one portion of one pill does not mean the other portion of the other pill, or the other maybe 5 pills you purchased contain lethal doses of fentanyl or some other opioid. As far as penalty goes, again, the DEA at the federal level, we are focused on the highest level organizations that are bringing these pills into our communities. We are not, again, looking at these drug users. We collaborate with departments like Fort Worth PD to be able to identify retail dealers and start working up the food chain. So anything less than 40 grams of fentanyl will be like a 0 to a 4-year prison penalty. 40 grams or more kicks off an automatic minimum 5-year mandatory minimum. If you have 400 grams or more, which may seem like a lot, but if you saw some getting thousands and thousands of pills in one particular seizure, those are usually a 10-year mandatory minimum. Now, I will say one thing that we are collaborating with all of our North Texas law enforcement partners on a day in and day out basis is there is an overdose that has occurred, whether it's resulted in death or not. We want to be able to be on the front lines with our partners to be able to identify opportunities to find the individual responsible for providing those lethal doses. If we are able to partner with departments like Fort Worth PD, Tarrant County Sheriff's Department, any of our area partners, those potential federal felonies, if we can prove that this person gave that lethal dose and medical examiners confirm that they died because of an acute fentanyl overdose, those will carry a mandatory minimum of 20 years to life in prison. And again, those are always the highest echelon that we're trying to achieve. We're not, much like Officer Blair is saying, we as the DEA are not trying to put drug users in federal prison. We want to put these criminals responsible for profiting off of the backs of those who struggle with addiction. We want those people in prison.
All right, thank you for that. Heath, this next one is going to be for you, and it's a two-part. The first part is if MedStar responds to a potential overdose call, do the police respond with you? And the second part of that is if Narcan works, does the person still go to the hospital? If that
makes complete sense. That's great questions. Yeah, so the police department does respond to us. So anytime there's an overdose, there's a lot of unknowns. And so ultimately safety comes first. We don't ever assume we know what the overdose is. And so there's multiple drugs out there, obviously. So some of them can make these very agitated and they become superhuman, if you will. And it can take multiple people to get them under control. The other part is the investigative piece. We don't know where that overdose is headed, whether life or death we're going to save or what's going on, what's in the house, so forth. So yes, they do respond with us along with the fire department. After Narcan, so this is very touchy, and I will say this and I'll stick to my guns on this. Narcan may get them breathing again, but it only lasts for as long as the dosage was. We have no idea the potency or the amount of fentanyl or opioid they ingested or used. So as long as we can get them breathing, they're going to the hospital. Now, to tack on to Officer Blair's comment, they're not there to get somebody in trouble, but if it's the sake of their safety and it's going to be jeopardizing their health and they need to go to the hospital, they're going to assist us in getting this individual to the hospital. Because should we leave them at home, they're going to revert back right to that respiratory depression and the outcome is going to be poor. So they will go to the hospital.
Okay, let's see. Kira, did you have any you want to add in over there?
I do. I want to actually circle back over to Officer Blair and maybe Dr. TJ, you may be able to touch on this too with you being in the school systems. But I know several districts have random drug testing and drug dogs that do random searches, and I think there's some miseducation on that or like why that is done, and parents may often think that it's to penalize their students or their kids. But can you talk a little bit more about that and what the benefit is of that? And then maybe the second part of that is, with all of this that's going on, even with those testing that's happening, does any of this matter with fentanyl? Just driving that point back home.
Sure, I'll touch on that. So a lot of the districts will hire drug dog companies that also have bomb dogs, gun dogs as well for the larger school districts, some smaller ones. But they use them as an asset. Like Special Agent Chavez had said, and Mr. Stone with MedStar, is this stuff is very dangerous. And so if these kids are, carrying it throughout the day at school, who knows whose hands it's going to be a part of, where it's going to go. So we take it very serious. So when the parents sign up, they can sign up their kids, play sports or whatever, to get randomly drug tested. It's not that they just randomly pull any kid from the classroom and drug test them. Now with the drug dog at the district that I'm at, it's a waiver that you sign when you sign your student code of conduct that the dog can come into a classroom, it can search a vehicle, bathrooms, they can pull backpacks, that sort of things, the principals. Now I still have to abide by, having probable cause. I don't just go in and search. It's an administrative thing, unless there is probable cause. But what typically happens is if a drug dog hits on a student's bag or their persons or possessions, then the administrator will get me involved. But it is absolutely beneficial, because we don't want, what happens is, for example, at the school I'm at, we had a kid a couple weeks ago who said he found a few pills in the bathroom and took them because he was curious. This kid was fine for about 30 minutes and then was absolutely not able to walk, communicate, talk, was staggering around. Luckily, he has a brother that goes to the school as well, and he was able to notice that something was up, and we were able to get the kid help. He was taken by MedStar to the hospital. They administered Narcan multiple times, but those are the kind of things that we want to find. And if we're able to get a drug dog in a bathroom to sniff out pills or marijuana or something like that, that can help prevent somebody from getting hurt or, overdosing, then that's absolutely what we're going to do. And then another thing I wanted to touch on while I was talking that I had written down that I forgot to speak on, another thing kids surprisingly do not understand, and it's not just kids, it's working patrol. I came across this a lot as adults as well. And I'm sure Mr. Stone and Special Agent Chavez can see, is a lot of people don't know that it's their obligation to get help. If they are with a friend or with somebody, I've had multiple students who are like, oh yeah, my friend was overdosing, but we left him because we don't want to get in trouble. Please, as parents and anybody else that's in communication with you, reiterate to them that it's, one, an obligation that they have, but two, it's what's going to save their life. A lot of these overdoses that we've seen, and Mr. Stone can attest to this probably way better than I can, but if you have somebody there with you that contacts 911, that's able to, start CPR, do things like that until help arrives, it can save somebody's life. And these kids had no idea. They're like, oh, well, I didn't know that I was obligated to do that, or that I could have got criminally in trouble for leaving somebody. You have to render emergency aid to somebody who's struggling. So I just wanted to get that out there as well.
Also, the person who gets the aid to them or calls 911, they're covered under Good Samaritan. Is that correct? Okay, so they're covered under the Good Samaritan. And so even going back to having those conversations with your kid, it's, do you know what to do if you feel like your friend is overdosing? And it's not an overdose looks different depending on what substance is being used, but just the simple part of stay with them, call 911, follow the directions of the 911 operator. It could be that simple. Or take them to the hospital and physically take them inside. Don't leave them at the door. Those kinds of things. Going back to the drug dog conversation, I look at it as it's also an opportunity to get intervention involved. Again, we're not out to, yes, there are consequences. I always want to reiterate that. Yes, there are consequences, but the ultimate goal is to begin intervention, because the earlier intervention starts, the better the likelihood of the outcome. And prevention is cheaper than intervention, and early intervention is cheaper than later intervention. And so that is the goal, is to provide education to the student, to the family, to get services, to get help. Because again, substance use is just a sign of something else going on. And we can talk the use all day, but until we get to what's going on to start the use, the purpose of the use, it's not going to, the outcome, the success rate is not going to be high. And so that's what we're trying to do. We're trying to figure out what is the cause, what is the purpose of the use.
Perfect, thank you. Mr. Stone, a question. We've talked a lot about Narcan. Have you ever encountered a situation where it was used improperly? Is that possible?
Possible. So it only works on one type of drug, right? Obviously opiate. But we see some methods where people are unsure what the drug is. And so, i.e. Suboxone. right? Suboxone's used, as methadone or a type of drug to get people off. And so they think, okay, Suboxone may be what I need to help my friend. So they'll crush it up, put it in their mouth. Well, it induces, a lot of vomiting, right? And it gives it the opposite effect. They start having the seizures, anoxic brain injuries, and so forth. But the improper use of naloxone or Narcan, if I had to sum it all up, would be it's not a free pass to use the drugs, right? And I go back to the potency of the drug, and it does not mean it's always going to work. And so by the time we get there, even though we may be there just in time to give the Narcan, there's already damage done. And so improper use, I would say no, not typical. It only works on one type of drug. And so we get a lot of, my son wouldn't use that. Well, unfortunately, it is an opiate because this drug only works on one thing. And it's just a lot of denial. But I'll end with, there was a Fort Worth police officer that retired a couple years ago. And I pick up a lot from working in the street. And he told the mother, privacy is not protection. And so she said, well, I give my daughter privacy. He said, well, then you're not protecting them. He says, I admire your ability to give them privacy. He said, but that's not protection. So privacy is not protection. And then he told her, you won't always be able to protect them, but you can sure try. He's like, privacy is not the first step. And I was like, wow, that's good stuff. And so that just tells you they're there to help. And those are good words to carry forth. But I wouldn't say Narcan on the vest is the stop all end all. So.
Absolutely. So I don't have a question here. This is a comment just based off some of the experiences that, unfortunately we've witnessed. But one of the things that I have the great option of doing is talking to our youth and our kids and our students on campus. And I know that you hear us talking so much about having these conversations with your kids, but just to give an example of how beneficial that is, I go in and just simply talking to them, and they have lots of questions. They have just as many questions about drugs and substance abuse and alcohol and mental health and behaviors as we do. And I think we have to remember that, their brains are just taking in lots of information. And if we, like he said, if we're protecting them, well, we also want to give them the education and the resources and not, leaving the opportunities for them to get it from other places. And if we're not willing to step in and have these conversations, how do we know what information they have and what they're getting it and how they're processing it? And so just knowing they want to have these conversations as long as they feel an open and safe space to do that, but they ask lots of questions. I had a conversation and I had questions submitted anonymously. I had 99 students, high school students, 10th and 11th, 12th graders submit questions asking about drugs. They want to know. They're willing to listen.
Kiara, an activity that I do when I'm doing presentations, I have like 3 different categories, and I have student kids or adults, and the categories are what do you know about drugs, what do you think you know about drugs, and what do you want to know about drugs. And I give them post-its, and they can write down whatever they want to write down and then post it where they want to post it. And then in the course of my conversation, I go and pull those, and I, to the best of my ability, address those things, because sometimes what they know is not necessarily factual either, And so, but it gives a good depiction of what is out there, what is being said, what's the truths that are out there, and what are the myths that are out there, and then what are the gaps in the knowledge. And again, this is for adults and for children.
That is a fantastic activity idea, and I am pretty sure that some of our staff will be, let's just say, borrowing it in days to come, because I love that. I think it's so incredibly impactful, and there's so many points to this conversation that I'd love to kind of circle back to it and follow up on. So many good points made, but we do want to be respectful of all of our speakers' time and the time of everyone who's tuning in tonight. If you did have a question and we did not get to it, or if tomorrow as you're going about your day, a question comes to mind as you kind of process everything you learned and heard here tonight, we would encourage everyone to go to our website, challengetc.org, or Google Challenge of Tarrant County. And you can submit your question using the Contact Us form. And we will promise to see to it that the right expert gets your question answered. Before I turn this back over to Kiera to kind of close us out, I just want to reemphasize just how big of fans we are of school counselors and interventionists. If there's any parents out there watching that have questions about how this issue is impacting your child's school, how to have an impactful conversation with your student, or if you're a student who's been impacted by drug use in any way, please do reach out to your school counselor, interventionist. They are just such incredible resources and they want to talk. So let's take them up on it.
Absolutely. Well, thank you so much, Tiara. That concludes our event for tonight. Thank you everyone who chimed in and participated and asked questions. Wanted to let you know that this was recorded and will be available later this week on the Challenge website. So again, www.challengetc.org. So think of, your friends or your family members who would benefit from this conversation. I honestly think everyone would benefit from this. So share it out. It's available. Share it. We invite you to check out any additional information on our website and how you can also connect with our community coalitions. We're right here in your community. There's always opportunities to get involved. Last, but certainly not least, thank you to each one of our speakers on tonight. You guys presented some really great information. Special Agent in Charge, Eduardo Chavez with the Dallas Field Division, Heath Stone with MedStar, Dr. TJ, the Hope Pusher, and Officer Mark Blair. Thank you guys for your time and attention tonight. Without further ado, we are going to go ahead and conclude. Thank you. Have a good evening.